The procedures for fabricating a band and loop space maintainer will be presented in 3 parts. This videotape shows the first clinical appointment with the patient, during which the band is fitted to the anchor tooth.
Isn't that fun?
How are you, Eric?
Fine.
Remember that silver ring that we were going to put on your mouth, in your mouth? We're going to do that today.
This patient has lost his mandibular left first primary molar, and his radiograph shows that his first premolar is still under several millimeters of bone.
Open real big for me. Ah, boy. Could we have a little Vaseline on his lips?
Mm-hmm. Just a little Vaseline.
Since the procedure requires that the patient keep his mouth open for extended periods while the correct size band is selected and fitted, and since an impression will need to be taken, apply Vaseline at the beginning of the appointment. Then use a mirror and explorer to examine the anchor tooth for caries. When you have confirmed that the tooth is caries-free, examine the tooth visually to estimate the approximate band size for the anchor tooth.
May I see the bands, please?
Select a band from a tray of preformed contoured narrow bands. Orient yourself to the band. Find the occlusal indentation on the lingual side of the occlusal surface of the band that corresponds to the lingual developmental groove of the mandibular second primary molar.
Just pushing.
Push down on the straighter lingual side of the band, and then slide the opposite side over the curved buccal surface. Seat the band as far as possible with firm digital pressure, to the height of contour in this case.
That feels pretty good. Let me try.
The band appears to be the correct size for this tooth, but to be sure that you've found the smallest possible band that will seat to the height of contour, try a band that is a half size smaller.
Push. Push.
Note that this band is definitely too small. One side dislodges each time pressure is applied. Reseat the earlier band, since it has proven to be the smallest possible band for this tooth. Use digital pressure to reseat it to the height of contour.
And
To push the band beyond the height of contour, apply pressure over the entire occlusal margin of the band with a flat-surfaced instrument such as this band rocker. Direct pressure along the entire edge of the band.
pushing.
Continue the pressure applications until the occlusal surface of the band is even with the occlusal plane of the tooth.
Band biter, please.
Next, use a band seater with a lead peg to direct concentrated force parallel to the long axis of the band.
Just bite very softly. Wait a minute. Wait till I ask, hon. Wait till I ask.
Place the serrated tip of the peg first on the lingual occlusal edge of this mandibular band, and have the patient bite down slowly on the back of the instrument.
Bite again for me. Soft. Turn this way, honey. Open. Bite again. Harder. Harder. Open. Bite.
Move the peg to a new point on the band's occlusal surface each time the patient bites down. Repeat this step at different locations. Place a finger under the peg to protect the gingival tissue in case of slippage. Continue this procedure until the band slides over the tooth's curved buccal surface and the occlusal surface is slightly apical to the proximal ridges.
Bite again. Good. Open. Open real big for me, Eric, so I can see.
Continue checking the band's position and having the patient bite down on the band seater until the entire gingival edge is in the gingival sulcus.
Bite. pusher, please.
When the band is fully seated, use a band pusher to adapt the band to the morphology of the tooth. Press the occlusal margin of the band into the grooves of the tooth using the serrated side of the band pusher.
Pushing, Eric. Just pushing.
Use the opposing thumb to apply pressure to the tip of the band pusher.
Pushing.
Reposition the instrument as necessary to close all gaps and burnish the entire occlusal margin of the band.
Push. Push. Just wash and dry.
Remember the bathroom sweeper area?
Rinse and dry the area so that you may check the fit of the band.
May I see an Explorer mirror, please?
Use an explorer to check the occlusal margins. The band fits tightly against the tooth. The explorer tip does not engage any part of the margin. The band does not rock.
Turn your head this way, please, Eric.
Check the gingival margin of the band to see that it is in the sulcus at all points. Finally, use articulating paper to make sure that the band is out of occlusion.
Bite down for me, Eric, please.
Have the patient bite down
Just
on the
tap it.
paper.
Get it. Real soft. That up. Now open real big for me.
Check that the blue marks are only on the tooth, not on the band.
So we're going to take a...
The band is out of occlusion. Take an impression of the quadrant of the mouth containing the anchor tooth. Use an impression tray which extends 5 to 6 millimeters beyond the distal surface of the tooth.
Okay, that's fine.
Fill the tray with impression material, in this case low-fusing compound which has been softened in hot water and molded into the tray.
Is this gonna hurt?
No, honey, it's just...
Before placing the tray, check that the compound surface is flat and no longer hot.
This looks like chocolate pudding, Eric. Okay, it's going to make a statue of your teeth. You've had this before. Open real big for me.
Seat the tray from the distal toward the mesial end so you can see that it extends beyond the anchor tooth and press down firmly. Cool the low-fusing compound with a gentle flow of air to hasten its setting.
It sure is a bit helpful.
Check the compound periodically with your fingernail to see if it is set. When the compound feels hard to your nail, it has set adequately and you may remove the tray. Examine the impression closely. Be sure that the outline of the band is distinct from the outline of the tooth and that the entire area from the distal surface of the banded tooth up to and including the abutment tooth is clearly reproduced.
Band remover, please.
Use a band removing pliers to remove the band from the patient's mouth. Place the lower beak of the pliers under the buccal gingival margin of the band and the upper peg on the occlusal surface of the tooth. Squeeze the pliers gently to lift the band a few millimeters at a time so that the band's contour will not be distorted.
You can close your mouth there.
Turn the band so that the gingival edge is toward you and seat the occlusal edge in the impression material. Press the band firmly into the groove with your fingers. Examine the scented band closely to see that the occlusal margin contacts the impression material at all points. The band is now ready to be stabilized in the impression.
Thank you, Eric. Turn your head straight for me, please.
As soon as the patient has been dismissed, stabilize the band in the low fusing compound by applying a hot spoon to the impression material at the outside corners of the band. The compound will melt against the band. Press down firmly on the band during the luting procedure to ensure that the band is stabilized in its original position. The impression is now ready to have a stone cast made.